Okay, today we're going to talk a little bit about Botox, which is a neurotoxin. It blocks the signal between the nerve and the muscle. What we like to say to patients is that the nerve sends over a fancy purse. When the muscle gets the purse, it contracts. You'll notice when you have a young child, every time they move their forehead, they're going to wrinkle in the same spot. And over time, they're going to lose collagen along those spots. And that's what creates lines in the forehead, as well as vertical lines or up and down lines around the nose area, and lines around the eyes. So what Botox does is if you imagine that the nurse, every time she's trying to move, she's sending over this fancy purse. When the muscle gets the purse, it contracts. Botox comes through and snatches and steals all the purses. So what that does is two things. Botox works both as a preventative and as well as a treatment. So treatment modality means that when she's trying to move, Botox is stealing all the purses so she doesn't move. And what that means is that her forehead will be smooth. The preventative portion is the fact that when she cannot move, she's not going to induce the wrinkling or the loss of collagen over time, which means over time, she's not going to age as fast. Remember that in plastic surgery, we've moved more towards age or a prevention of the aging process, slowing it down. We can't eliminate aging, but what we can do is we can do everything we can to slow it down. So in Botox, we use that mainly for the upper third of the face. I like to talk to patients about breaking the face up into thirds. We talk about the upper third, the middle third, and the lower third. This goes way back to Michelangelo and some of the painters way back in the early times. They were really the early anatomists, and they would break up the face in horizontal thirds and vertical fifths. So we like to talk about that because it makes a lot of sense when you're talking about Botox, fillers, ultherapy, facelifts, all that kind of stuff. The top third is really what we're going to emphasize when we're talking about Botox. Later on we'll move into the middle third. The middle third has a lot to do with fillers as well as some other surgical options. And the lower third we start getting into more ultherapy or facelifts, neck lifts, those kind of things. So today we're talking just about the upper third and Botox. Yes, we can use Botox in the lower third, but the thing is we're only going to concentrate really on the upper third. What happens is, whenever you're talking about Botox indirectly, you're talking about a tug-of-war between two muscles. She has muscles here that's going to pull her eyebrow up. She has muscles here that are going to pull her eyebrow down. Whenever we give Botox, if this is the tug-of-war rope, these guys are pulling up, these guys are pulling down. If we give shots here to stop, what Botox does is it makes the guys that are pulling down let go of the rope, and then these guys pull the brow higher. So we're really trying to balance the Botox that we give at the top and the Botox that we give around the eyes to make sure that the brow stays in a nice natural higher position. Most women as well as men don't want their brow really low. We can give her a lot of Botox and lower her brow, which is not ideal. We want to get rid of the wrinkles on the top of her forehead as well as keeping her brow elevated. The other thing about Botox is people ask, how long does Botox, when I use the word Botox, I'm talking about we're talking about anything that's going to stop the signal between the nerve and the muscle. You can say it's Botox. We also use Dysport or Xeomin. Here we use predominantly a lot more Botox than we do Dysport or Xeomin. And what those things, they all work similar. So we're not going to get into the differences today of the neuromodulators. So what we're going to do right now is we're going to give her just a little bit of Botox so you can sort of see what the process is like. Raise your eyebrows up, relax. So you can see that she still has some Botox on board. Raise your eyebrows up. You can see some movement in the midline. She's got more movement over here is what we want to do to keep her brow higher. Frown down in the middle, squeeze, relax. And you can see that these, what they call the 11s, sometimes they're even more than 11, but those are vertical wrinkles that are created by a muscle called the corrugator that runs between here and here. So we'll give her a little shot in the midline just to stop that. So we'll go right where the muscle is, right here, and also right here. And this is really just touching up some of the Botox that she already has on board. Raise your eyebrows up. We'll also go up here to try to knock the lines out that you see that run across her forehead. Raise your eyebrow again, relax. and here to get those little bit of wrinkles that you see on the outside. And of course, whatever we do on one side, we want to do it on the other side to try to keep her in balance. So that's Botox. It'll take about 2 weeks for the Botox to set up. So in other words, today she'll move normally, as well as it'll start over the next 2 weeks completely setting up. Here we use the smallest needles made to try to keep the patient out of pain. As you can see, it's not a very painful procedure, but yet it does require a needle.